Our organization is the statewide political and policy arm of the reproductive freedom movement in the state of Maryland. The NARAL Pro-Choice Maryland Fund, which is our 501c3 entity, handles all our education, our outreach, our advocacy, our policy research, our coalition building, the kind of work we need to do to find out from people exactly what their barriers and challenges are for reproductive freedom and healthcare access. That work informs our 501c4, NARAL Pro-Choice Maryland, that does our lobbying and political work. Pregnancy is a very timely medical event, and seeking health care for a pregnancy is essential health care. So that's where we step in. We make sure through education and outreach, through reforms that we might have to do through a county ordinance or a legislative mandate, that every Marylander has a right to choose. They have a right to bodily integrity. They have a right to make a decision about when they want to become pregnant, what they're going to do about their pregnancy, and to bear healthy children. We have 8 issue campaigns in order to try to really capture the realm of reproductive freedom in our state. Not only do we look at abortion care access, we look at access to contraceptive methods and birth control, family planning, including emergency contraception. We look at pregnancy discrimination at work, at school, for those who are incarcerated. We look at maternal health outcomes to make sure that people actually have the access, the resources they need in order to have healthy pregnancies and protect their future fertility. We're interested in economic security, so that way you can make a decision when you want to form your families and that you have the right to actually take care of them once you have them in your lives. And even open your doors to adoption and foster care if that's something that you want to do. We're very interested in what happens with youth that are situations where in the care, custody, control of the state, in foster care, in our schools, that are experiencing housing instability, economic instability. And one of the initiatives we're actually doing this fall is building access teams across the state so that local volunteers can be involved in all these issues. When the pandemic hit, NARAL Pro-Choice Maryland was very cognizant of the fact that a lot of patients were confused about whether or not they could access abortion care. We took to social media to tell people that the clinics were open and willing to see patients. At the same time, we also realized that a lot of workers were losing their health insurance and they would need access to birth control. So we had a campaign of giving out 2,000 packets of emergency contraception to individuals and groups on the front lines of those trying to provide relief. We also looked at people who are incarcerated, people who are coming into the criminal justice system. If they were pregnant, they shouldn't be in the system. They shouldn't be sitting ducks to a virus that we still don't actually understand that much about how it affects pregnancy and how it affects infants. And then looking at our schools and the mandate for remote learning. What does that mean for parenting students if they don't have access to childcare? Can they actually authentically be involved in a classroom setting that's remote when you don't have any way to take care of your baby? And there's also concerns about how if we limit the type of classroom instruction that's going on, does that mean school districts are going to say sex education is elective and we don't need it? For the last 5 years, NARAL Pro-Choice Maryland has been really building all our resources and our capacity, and we haven't been able to do it except for your great, incredible support. We've had now close to 100 interns serve in our policy and research internship. We've been able to triple our staff. This last legislative session, we weighed in on 130 bills. We've helped draft 9 original pieces of legislation and pass 4 into law. Your commitment is what makes us be able to be responsive to your needs in our state. Thank you.